Patients often ask, is my pelvis crooked? Look, is my pelvis crooked? There are such concepts as a twisted pelvis, a pelvic misalignment. And many patients are concerned with the symmetry of their pelvis. Sometimes even more than anything else. This probably arose from watching numerous videos where either doctors or someone else are diagnosing and determining the position of the pelvis, whether it is in the right place. According to certain markers, they look if the bones of the pelvis are asymmetrical. They look at the back bones, the sacral bones, the front bones, whether the pelvis is crooked, the pelvis is twisted, the pelvis is such and such. And accordingly, many patients also say, here, my pelvis in this position, I feel like one half of my pelvis is going forward, the other half of my pelvis is going back. I stand asymmetrically and try to level this position. But why is it like that? Why does a person standing in place have such a specific curved form? Why is he in such a position? Everything is held by our muscles, ligaments. Muscles are what moves each of our joints. It's specifically muscles that do this. And when we move, certain movements occur due to these muscles. Repetitive movements. You make several thousand movements a day. And whether a muscle is working or not, whether it's shortened or, on the contrary, excessively relaxed, whether it can perform its function at all, depends in part on the position of your pelvis. If you look at yourself in the mirror and see that your pelvis is not symmetrical, you don't need to think about standing asymmetrical and looking more symmetrical in the mirror. This crookedness, it's a reflection of your movement. You're walking. If with every step you make such a movement, if with every step you lean to the side, if with every step, when you walk, you shift your weight onto your leg and your pelvis doesn't hold, it goes to the side, of course, then you will see such a position in the mirror. And you don't need to, looking in the mirror, standing, correct this position anymore. You need to correct the movement you make because what you see in the mirror is a reflection of your movement. It's a reflection of what you've done several thousand times in one day. And this happens day after day. If day after day you do this with every step, why are you surprised that you then see this in the mirror? You try to straighten up, you say, maybe it's because I carry a bag on my left shoulder. Yes, that could be a problem. Why do you carry a bag like that then, if you know that? The balance is maintained by the gluteus maximus, the lumbar muscles, the rectus femoris muscle, the muscles of the lower back, the quadratus lumborum, the oblique muscles of the abdomen, and the rectus abdominis muscle. Typically, 90% of cases have such a violation. The gluteus is weak. The large gluteus muscle along with the medium gluteus muscle, pear-shaped and shortened. The lumbar muscle along with the straight muscle of the thigh is shortened. The abdominal muscle, the straight abdominal muscle is weak. The oblique abdominal muscles are shortened along with the quadratus lumbar muscle. They are shortened so much that the ribs to which they are attached are fixed, and the fixation causes weakness of these muscles. Impaired mobility of the attachment points where they are attached. A slight movement, when the muscle is stretched, the tone is lost, it gets damaged. When there are already similar problems, they start to progress very quickly because the mobility of the sacroiliac joint is impaired in this case. The gluteal muscle provides the thrust of the leg forward. That is, when you walk, the function of the buttocks is to push you forward. Want to see how it fully works? Watch the video of runners, see how they run. They maximize the use of their gluteal muscle. If you run, well, okay, if the one who runs incorrectly runs, and his gluteal muscle doesn't work, he starts to run due to the fact that he shifts his center of gravity forward. His run is like this. He shifts his center of gravity forward and puts his legs in front of him. He believes that this is more ergonomic, conserving energy and the power of movement. He doesn't use his calf muscles, and his entire run is just moving his legs forward. And it's not just running, it's also like this for walking. That is, walking without using the gluteal muscles, and it's just falling forward and putting the leg out in front. The less your muscles work, the more your walk starts to resemble an old man's walk. A shuffling old man who has only a few muscles left, the ones that are still working, and he moves only because his center of gravity is shifted forward, and he puts his legs in front of him. No muscles are fully used. Why be surprised that they slowly atrophy? You don't use them after all. It's even worse if you don't use all these muscles and then suddenly make some movements, some physical efforts, where they participate at this moment. They of course get damaged because the muscles are not constantly toned. And here you want to put a lot of strain on it. At this moment, it gets injured. You don't let it recover, you continue to strain it. It gets injured even more. Structural changes in the muscle occur at the site of constant injury. These are not just trigger points anymore. These are already fibrotic changes. The muscle was constantly injured at this spot, and the connective tissue grew. The gluteal muscle should strongly push you forward with each step. When it does this, it stabilizes your pelvis. Your pelvis is held up by the powerful work of the gluteal muscle, which pushes you forward with each step. Want to see how it's done? Look at the runners who run with a straight back. They don't just run like that, they run with a straight back. They run to maximize the use of leg muscles, to maximize the use of gluteal muscles. You might think that if you lean forward, you'll run faster. In fact, you can develop maximum speed when your torso is vertical in relation to the ground, and the leg muscles are maximally involved in the movement. When the gluteus muscle is working, there is a stretch of the muscles on the front surface of the thigh. At this moment, they are stretching on the front surface of the thigh and the iliopsoas muscle, which goes from the ilium to the leg. This is the balanced work of two muscles. It ensures movement in the hip joint. If your gluteus muscle is not working in your stride, then your leg does not end up in this position. That is, you see, the pelvis stays in place, but the leg, the femur, goes back in the stride. At this moment, the gluteus muscle is strongly strained, and at this moment, the pelvis is held. If during the step the leg stays here, the gluteus muscle is not able to fully tense at this moment. Its attachment points do not come closer. It is not in tone. And when it's not in tone, you lean on the other leg because this one is not working. Here is the gluteus muscle from this side. From this side, the middle gluteus muscle can't withstand such a load. It also gets injured. And so you have pain from swinging from side to side like this. Then you approach the mirror and see such a phenomenon. Because they don't work in motion. Muscles, they are needed not only to support you statically, symmetrically, but also to keep everything in motion. And that's why this diagnosis, it's useless. The fact that the doctor's looking like this axis is raised here, this one is raised here, then they put you on the table, do a manipulation on the pelvis, they turn the pelvis, but then it goes crooked again, it twists again. And why do the lumbar and gluteal muscles become shortened? Why does any muscle become shortened? Because you don't make movements when it stretches. This is not an exercise. You are not supposed to stretch any muscle with exercises. There is not a single muscle in our body that would require a special exercise for its normal function, if there were no injuries. That is, every muscle, it performs a certain function. Every muscle, the small chest muscle shortens, but you don't make such movements when it stretches. The lumbar muscle shortens with the front surface of the thigh, but you also don't make movements in the step when it shortens. The intercostal muscles are short. You do not use the chest. The scalene muscles are short because there is no movement. The head is constantly in this position. The short flexors are shortened, tense. Why does this happen? Because the head is in this position. Because you also do not use the neck flexors. You can train some muscles all the time, stretch other muscles, but these muscles are not designed for constant training. That is, if some muscle was not needed, was only used during training, it would not exist at all. But it happens, it disappears, because you don't use it. And on top of that, because it's weak, it's very easy to injure it. The balance of the body is ensured by the correct work of the muscles in motion, in dynamics, when you use them, not just when you stand in front of the mirror. The same thing. The position of the head is also ensured by the coordinated work of several muscles. These are the long neck flexors, the scalene muscles, the sternocleidomastoid muscles, and the short flexors. The most common disorders are weak long neck flexors. The head falls forward. The upper part of the long neck flexors is usually shortened. There is excessive tension. The shortest flexors are also constantly in tension. There is a shortening in them. The scalene muscles are shortened, and this is all connected with the position of the blade. That is, it shifts simultaneously upwards and forwards. This is a shortening of the small pectoral muscle, which lifts the shoulder blade. The muscles also maintain this entire imbalance. It depends on how you use them. If one muscle is weak, you don't use it, so it stops working. If some other muscle is working, it can take over its function. For example, if the neck flexor is turned off, the muscle that lifts the chin can work in its place for a while. It will start to stretch, increase in volume, pain will appear, but it can hold the neck. The scalene muscles are short, but it's not always the case that, for example, the neck flexor doesn't work, and the scalene muscle becomes short because of this. Very often, the habitual posture in which a person is, that is, if he spends most of the day in such a position, then in any case, it causes him to shorten certain muscles. That is, he does not make those movements when these muscles are fully stretched, they work at full length. A muscle should be capable, full-fledged, a normal muscle, it should stretch and hold its strength in the extreme position. And in those cases when, for example, there is already a shortening of the muscle, it will be very difficult to restore a weak muscle. That is, in this case, when there is already a weakness of the gluteal muscle, it is very difficult to start training it. Because when you start training the gluteal muscle, you try to use it in the step, and it doesn't work. Instead, the lower back is strained. You may have heard that the gluteal muscle stops working, and the quadriceps muscle of the thigh takes over its function in the step. It shortens. It doesn't take over its function, but because the gluteus can't work, the thigh doesn't move separately. It doesn't go back separately from the pelvis. It starts to rotate together with the pelvis. That is, the pelvis doesn't stay in place, but starts to make such a movement together with the thigh. The leg goes back together with the thigh. And you get such a constant movement of the pelvis. Pain appears both in the joints and the muscles hurt, and the quadriceps muscle of the thigh and the spine extensor is overstrained. In order for the gluteal muscle to work, you need to remove its trigger points. You need to free the nerves. You need to remove the shortening of the piriformis muscle. All this is fine, but nothing will work until the lumbar muscle is shortened. The muscle on the front of the thigh is shortened. And to somehow stabilize the pelvis, It is necessary to simultaneously train the muscles and eliminate the shortening of the muscles. And the first thing you can start with is an exercise for the lumbar muscle. To stretch the lumbar muscle, and we do this to level the pelvis, and then proceed to the training of the gluteal muscle so that it could later participate in the step. That's the exercise. That is, put one foot forward. We will stretch the left lumbar muscle. Put it back. That is, start exactly with this position. Your front foot should be in line with your body. And in this position, put your foot here. You stand, put your foot on the toe, and in this position, straighten your leg at the knee. The buttocks remain in place, and keep your body vertically. And if you have already felt a stretch somewhere at this moment, either on the front surface of the thigh or forward from the hip joint, or slightly inside, then you need to stretch it in this position. That is, stop in this position. The most important thing is to keep your pelvis in place. If you notice that your pelvis is turning like this, it turns out like this on one line, both the waist and the leg are on one line, then at this moment it may seem to you that you can put your leg far away. You can make such a movement. But if your buttocks turn together with the leg, then there is no point in this. That is, you need to stretch the leg relative to the buttocks. And as you stop feeling the stretch here, you can already put your leg a little further, but you need to leave the buttocks in the right position. And you can feel the stretch either in the thigh or on the front surface of the buttock area. That's where the lumbar muscle stretches more. And the main point is not how far you can put your leg, but to do it in such a way that your pelvis stays in place. The leg, it seemed to be separate from the pelvis, behind. But for walking, you don't need to strive too hard to stretch. For the gluteal muscle to participate in the step, it needs to be stretched approximately the length of a wide step. If you want to run, it's best to do it with a reserve. That is, it can be stretched to a greater distance. But the most important thing is not to twist the pelvis. You may get a false feeling that you can put your foot further. However, this is incorrect. Your pelvis will turn together with your legs, see? And nothing strains during this. Or you feel just a slight stretch, and you need to turn your pelvis slightly forward. Then you will feel the stretch on the front surface of the thigh. When you've done this exercise for 3 to 4 days, you'll notice that your stride becomes more free-flowing. Your step becomes a bit freer, a bit longer, because the gluteal muscle has the opportunity to engage in the stride. And only after this can you proceed to training the gluteal muscle, which we will talk about in the following episodes.